Good morning everyone, and today we're going to be talking about under eye dark circles. So everyone who's affected with them always wonder that are they treatable and what are the different treatment options that are available. So I hope today this video helps you a little bit. Coming to the different causes of under eye. So the first one is hereditary. So if you do have a familial tendency to pigment in your under eye area, then most probably you're going to be experiencing it too. So, and these type of dark circles are usually very difficult to treat. The second one comes due to age. So with age, as you start aging, there is collagen degradation that occurs in your body, and the fat pads that are present in the middle portion of your face kind of like are lost and start sagging. So this enhances the hollowness that is present in our eye socket, and because of this hollowing, there is shadowing that is present, and this shadowing comes across as pigmentation. The third one is if you have thin skin in your under eye area, then the underlying blood vessels that are there, you can see the underlying blood vessels, and this reflection comes up as a bluish black discoloration which is seen on your skin. The fourth one is allergic. So usually when there's a change in season, or when it's winter, or when you just have an allergic tendency and your eyes start watering, there's a tendency of rubbing your eye, and this friction also leads to pigmentation. The fifth one is usually use of medication. So a lot of oral contraceptive pills, anti-malarials, ophthalmic eye drops, prostaglandins, all of them cause pigmentation, and this might be also why that the under eye pigmentation is more if you're on these drugs. And the last is your lifestyle. So if you do have an underlying cause of diabetes mellitus, hypothyroidism, metabolic syndrome, all of this leads to an acanthosis-like pigmentation which is present below your eye, where the skin becomes really thick, velvety in texture, and also blue to black in color. Also other things like inadequate sleep, inadequate nutrition, a stressful diet, being in front of a computer or your phone screen continuously also increases your chances of pigmentation. So when we come to the different treatment options, we need to see what the cause is, and then your treatment is individualized based on what your cause of treatment is. So the first one, which is common to everyone, is always using a proper corrector and concealer to camouflage or cover up your under eye. So I usually tell my patients to use a corrector which is brick in color or orange in color, as it masks the under bluish black tinge of your skin very well. Second, coming to your nutrition. So having lots of fruits, having green leafy vegetables, having fruits that are rich in omega-3 fatty acids like walnuts, nuts, salmon, fish oil, all of this helps. Also, oral collagen and antioxidant supplementation also helps, as it prevents all the degradation of the collagen that's there, and also leaves your skin just feeling fuller and healthier. Now coming to your lifestyle changes if you have an underlying disorder. So if you do have hypothyroidism, if you do have diabetes, if you have an underlying metabolic syndrome, getting these conditions treated and corrected first does always have an impact on your under eye, and you can see a change in them when you treat these underlying conditions. Now coming to the different topical treatments that are available. So these are usually called as lifting pigmenters, or also known as hypopigmenting agents or depigmenting agents. So here a lot of creams can be used. We could use an azelaic acid cream, we could use a kojic acid cream, hydroquinone, arbutin. All of these are helpful as depigmenting agents. Even retinol is used. Usually when there is a puffiness in your under eye area, and it is usually due to a vascular cause, and even vitamin K creams are used in this case. A lot of other creams with green tea extracts, caffeine are also used, along with the other depigmenting agents that are there. After this, you could always do chemical peeling. Again, peeling helps in removing the pigment or lifting the pigment from the skin. We also advise the QSwitch laser, which is again a pigmentary laser. It usually targets the melanin in the skin. So usually doing a sitting once in 2 weeks and up to 6 sittings helps quite a lot. Now, when you have an anatomical or age-related defect because of the hollowing that is seen, we usually advise hyaluronic acid fillers. We use Juvederm fillers. So the fillers usually helps in plumbing the skin. It also gives the support from below. So your skin again gets fuller. It adds the moisture to your skin, and again that reduces the hollowing that is seen. Apart from this, you can also do fractional RF. This again promotes collagen remodeling, and this again leaves your skin fuller, so that reduces the under eye hollowing and the pigmentation that is seen. Other than this, the other techniques that are there, one is platelet rich plasma can be done. You could also do a fat transfer in your under eye area if the hollowing is too much, and if there's a lot of puffiness and loose skin, we also do advise an under eye blepharoplasty procedure. So whatever your cause is, first see your cause, target your cause, and that's when we go ahead with our treatment. And there are a lot of treatments that are available, and they do help in your under eye area. I hope this was helpful. Have a lovely day, guys. Take care.